Boston Medical Products proudly manufactures many of the finest medical devices available on the market today for use in ENT surgery and airway management. Boston Medical Products was founded in 1980 by 3 otolaryngologists. They wanted to provide the resources and professional skills necessary to make available to physicians throughout the world a complete line of specialty products. Working closely with surgeons, other healthcare providers, and patients themselves, Boston Medical Products has grown and evolved into an internationally respected medical device company. We are dedicated to providing the finest quality, most advanced products, combining safety, effectiveness, and unsurpassed patient comfort for use in otology, rhinology, laryngology, and airway management. Boston Medical Products takes great pride in the manufacturing and quality assurance of each and every product we sell. All of our medical devices are constructed using the highest quality medical grade materials and manufactured under strict quality control procedures. Our knowledgeable and friendly customer service professionals answer technical questions and facilitate orders daily. Most products are shipped the same day they are ordered and delivered according to your specific needs. At Boston Medical Products, we are constantly improving our existing products and developing new devices. Our quest for innovations to improve surgical procedures or enhance patient comfort never ends. We value your input and welcome inquiries regarding new innovations and custom products. Please call us toll-free at 800-433-BMPI. Outside the continental U.S. at 508-898-9300. Or visit our website at www.bosmed.com. The patented Montgomery Tracheal Cannula system has been designed to provide the surgeon a complete program for creating an airway, from initial incision through long-term tracheotomy care. The Montgomery Tracheal Fenestrator is a surgical steel instrument which incises a precise circular opening for proper placement of the tracheal cannula. The fenestrator works with standard suction equipment and is easy to use. Montgomery silicone tracheal cannulas are used in place of tracheotomy tubes to provide either temporary or long-term access to the tracheal airway, or where access is needed for pulmonary hygiene. All tracheal cannulas are made of flexible medical-grade silicone to assure patient comfort and safety while reducing complications usually associated with the use of standard tracheotomy tubes. The Montgomery tracheal cannula can be used in place of a tracheotomy tube and in cases of sleep apnea, laryngeal carcinoma with glottic insufficiency, following safety tube removal, chronic lung disease, and intermittent laryngeal insufficiency. When creating a tracheotomy for the silicone tracheal cannula, it is usually best to make a vertical incision. This is because the angle of the cannula in relation to the trachea is more easily adjusted. However, a horizontal incision can also be used and will be demonstrated here. The horizontal incision is completed. The strap muscles are separated in the midline. The isthmus of the thyroid is separated from the trachea, clamped on both sides, and sectioned in the midline. Each side of the thyroid isthmus is suture ligated. The tracheal wall is injected with xylocaine and epinephrine. The trophine fenestrator is used to make the opening in the anterior tracheal wall. The tracheal fenestrator consists of an outer trophine knife which fits over an inner cannula. The cutting edge is designed to both cut and saw through tissue and cartilage. The inner cannula of the fenestrator is attached to suction and placed against the trachea. It immediately adheres due to negative pressure. The fenestrator is advanced and rotated, thus cutting an 8 mm hole in the anterior tracheal wall. The incised core inside the fenestrator is safely removed from the trachea by suction. All Montgomery tracheal cannulas have a patented ring and groove system, which serves to secure a faceplate or ring washer in place. The short-term cannula has 3 circumferential barbed-like rings that help to keep the cannula in position. The long-term cannula has a smooth surface adjacent to the 27-degree flange. This surface permits and encourages growth of epithelium from both the trachea and the skin to ultimately line the tissue of the tracheotomy tract. A groove is present inferiorly, which serves for drainage and as a point of reference. The endotracheal tube is removed. The cannula is lubricated and grasped with a curved hemostat and inserted into the trachea. The longitudinal groove is in its correct inferior position. The wing-shaped faceplate, which is used for the first week to secure the cannula in place, is compared to the ring washer. The faceplate is inserted over the cannula. An endotracheal tube is inserted into the cannula as the patient recovers from anesthesia. The faceplate is sutured to the skin to prevent displacement of the cannula. The plug is inserted into the cannula. A suture has been threaded through the plug to form a necklace. Boston Medical Products also has a convenient plug holder to help prevent loss of the plug. After several weeks, the short-term cannula should be replaced by the long-term cannula. Here, the long-term cannula is inserted in the same manner using a curved hemostat. After insertion, the flange is seated against the anterior wall with a longitudinal groove in its correct inferior position. The ring washer is advanced to the correct groove depending on the patient's neck size. The number of grooves external to the washer are counted and recorded. Again, an endotracheal tube is inserted while the patient recovers from anesthesia. The Montgomery extra-long long-term cannula has been designed for use in obese patients or Pickwickian-type patients with sleep apnea or who require a long-term airway. It allows for easier insertion, less incidence of granulation tissue formation, gradual epithelialization of the tracheotomy tract, and can be used with new or existing tracheotomies. The extra-long long-term cannula set contains 2 ring washers, 1 plug, and 1 faceplate. The new sizes, 8 and 10 custom tracheal cannulas, are designed for patients who have larger trachs and require greater airflow through the tracheotomy stoma. The unique design allows the customization of the tube to fit virtually any length tracheotomy tract. By removing 1 or more rings, the smooth portion of the cannula can be increased to fit the patient's neck size. Customization is available from Boston Medical Products or by using the CK1000 customizing kit. The size 8 and 10 cannulas offer all the features and benefits that have made the standard tracheal cannulas so successful for airway management. After insertion, all Montgomery tracheal cannulas can be trimmed. This serves to provide a low profile for the tracheotomy patient and allow for the attachment of a speaking valve. The Montgomery speaking valves are designed to allow tracheotomy patients to vocalize without the need for finger occlusion. All valves provide one-way airflow using a thin silicone hinged diaphragm, which opens on inspiration and closes on expiration. All Montgomery speaking valves are noiseless, easily cleaned, durable, and offer a unique cough release feature, eliminating valve blowout following a forceful cough or excessive airway pressure. To summarize the procedure for the Montgomery tracheal cannula system: first, surgically expose the tracheal wall, preferably using a vertical incision. Create a circular incision using the Montgomery tracheal fenestrator. Insert the short-term cannula using curved hemostats into the trachea. The 27-degree angle of the flange will seat nicely against the anterior tracheal wall. If necessary, use the faceplate to secure the cannula in place. The faceplate can be replaced with a ring washer after 7 to 10 days. After several weeks, replace the short-term cannula with a long-term cannula, using a ring washer to secure the cannula. If the tracheotomy patient has an existing trach, select the proper size long-term cannula, insert, and secure with a ring washer. All cannulas can be trimmed to provide a low profile and allow for the attachment of a speaking valve. The Montgomery Cannula System, a complete system from incision to long-term tracheotomy management. For more information about this product, please contact Boston Medical Products at 1-800-433-BMPI. Outside the continental U.S. at 508-898-9300. Or visit our website at www.bossmed.com.